Welcome, everybody, to the Wellsprings Home Care Podcast. I'm your host, Justin Curry, and my two four-legged co-hosts are not with me today, even though we're working from home during this quarantine. But I wanted to jump into announcing our Best of Home Care Award because we're still really excited about it. But SeniorAdvisor.com actually gave us one of the 2020 Best of Home Care Awards. And what that is it actually recognizes the top 2 to 3% of home care agencies nationwide. So we're obviously really excited and really proud to receive that award. And we're really happy. We have such a great team on board, and great caregivers and great clients. And just for those of you who don't know, some of the services that we offer here at Wellsprings, we are a non-medical home care service provider. And we're based in Exton, Pennsylvania, and we serve the counties of Chester, Montgomery, and Delaware County in Pennsylvania. And some of the services we offer here at Wellsprings are personal care, so things like toileting, bathing, personal hygiene services, so things like oral care, oral hygiene, incontinence care, shaving. We also have caregivers that are specifically trained in dementia and Alzheimer's, so they're able to come in and track progress and or decline, depending on the situation. So they're really helpful to have in the home. One of the other things we offer is companionship. So if your loved one just needs somebody to talk to, we can either do that by telephone or we can have somebody come in and just be a friend and be there for them. And one of the other things we offer is mobility assistance. So if somebody comes home from skilled nursing, maybe they're in rehabilitation, we'll actually, help them. We'll do full transfer assists right up to standby assists where, they're just maybe not as sure of their balance as they once were. So we'll come in and help out and just sort of help them build that confidence back. So what we're going to be talking about today is how to apply for Medicaid in Pennsylvania. So for those of you that don't know, Medicaid in the U.S., it's actually a state and a federal program, and it really helps out people with limited resources and limited income, and it can offer benefits to pay for things like home care. So before we jump into how we can apply for Medicaid, I want to talk a little bit about individuals who are automatically enrolled. So they rolled out, the state of PA rolled out a program called Community Health Choices. And what that is it's Medicaid falls under that banner. And because of the change, there's people that, are currently getting services that will automatically be approved for Medicaid waivers. So the number one reason is somebody who is receiving both Medicare and Medicaid, they're automatically enrolled in Community Health Choices. Somebody who's receiving long-term Social Security in the attendant care, independence, COM care, or aging waivers, they're automatically enrolled in Community Health Choices. Somebody who is receiving services as per the OBRA waiver, and also clinically ineligible to be in a nursing facility. Also, receiving care in a nursing home that's paid by Medicaid. Anyone who is receiving care in a nursing home that is paid by Medicaid, they'll automatically be enrolled in Community Health Choices. And also, anybody who participates in the Act 150 waiver, who is both eligible for Medicaid and Medicare, that individual will also be enrolled in Community Health Choices. So those are some of the ways that someone can automatically be enrolled, and that's sort of like, I guess, grandfathering in. They were already a part of certain programs before Community Health Choices was rolled out, so they're automatically enrolled. Now, I just want to state also, individuals that would not be eligible for CHC. So if you fall under any of these 4 items, then you would not be able to apply for a Community Health Choices waiver with Medicaid. So somebody who is receiving long-term Social Security under the OBRA waiver and are not nursing facility eligible. And number 2 is an Act 150 program participant who is both eligible for Medicaid and Medicare. And also anyone who is in a state-operated nursing facility, including the state veterans homes. So any individuals that fall under those 4 items are not eligible for community health choices. So now that we've passed that, I just want to jump into, some of the different ways that you can actually apply for Medicaid. So there are 4 different ways that someone can apply for Medicaid, and 1 is on paper, 2 is in person, 3 is by telephone, and 4 is online using one of their websites. So on paper, you can actually download an application. So if you go to dhs.pa.gov and you follow the tabs to medical assistance, then you can actually download an application there and submit, usually by fax. And the second way is in person. So you can actually contact your county assistance office, and you can do that by just kind of doing a quick search online for your CAO, which is your county assistance office. And there'll be an address there that you can actually go to and talk to them, and they'll help you apply that way. The third option would be by telephone. So you can actually call the Consumer Service Center for health coverage. And the number for the Department of Health in Pennsylvania is 1-866-550-4355. And you can chat with them and they'll kind of guide you through the process. And the last way to apply, which is probably the quickest, but also if you're not that tech savvy, it might be a little bit more difficult for you, would be applying online. And through the DHS Department of Health, they use the Compass website. So if you just research COMPASS Pennsylvania, that website will come up and they'll guide you through the process on there. But you might want to have a family member or someone else help out. You can call us. We can help you guide through the process as well. And applying for any Medicaid waiver, it's like any insurance program. It is a bit of an arduous process. It's going to take some time. It's going to take, a lot of paperwork off the start, digging through some of your old records, providing, assets, incomes, things like that. So it does take some time to get started, but once you have that information and you have that approval, it's a very good benefit to be on, because they can some Medicaid waivers, they can be fairly long term and they can help out for a long time. So they're definitely beneficial, to somebody that does have that limited income. They can have somebody come in there and help out, and they typically adjust hours according to the health background of the individual. So if you do see any decline or, throughout the term, then, they're likely to add more hours as well. So Medicaid is definitely worth putting in the time and effort off the start. And, Wellsprings Home Care and our affiliates, we can help out with that as well. We're a Medicaid approved provider, and we're approved for all 3 MCOs. So that's Keystone First, UPMC, PA Health and Wellness, any MCO, which is a managed care organization, any MCO that the beneficiary picks, we can provide care services for. So that's about all the information I have on how to apply for Medicaid in Pennsylvania. So I really hope that helps guide some people through the process. I know it can be tricky, especially when you're not that tech savvy. Even myself, I struggle with that a little bit, as I'm sure most people do. But we're definitely here to help. So get in touch with us anytime. www.wellspringshomecare.com. And there's an S on the end of Wellsprings. And our phone number is 610-463-5787. 0880, and we can help you out anytime. So thanks a lot for stopping by, and we'll see you next time.